Good morning.
Arthur.
Thank you very much. So I'm going to speak to you about a new generation cloud-based software for amblyopia management called Bynocs. I am on the Medical Advisory Board of Bynocs, and I always have to disclose that I'm on the Board of Directors of Alcon, and this is my personal opinion about Bynocs. So amblyopia, or lazy eye, is decreased eyesight due to abnormal visual development, and it affects 2 to 4% of the global population, so it's a lot of people who are affected. And there are a number of shortcomings in the way we manage it. Residual amblyopia, there's poor compliance with patching, recurrence of amblyopia, deficits in stereopsis, and it's ineffective in adults, as we know. But we know that amblyopia is a binocular visual problem, and the newer treatment modalities are aimed at treating both eyes at the same time and not patching. So Bynocs is a company started out in India, and they've looked at it this way. Until telescopes were invented, no one thought Uranus, Neptune, and Pluto existed. But when you look at a problem in a different way, you might see different solutions. So Bynocs AmblyGo is the program, bursts the myth that adults can't be treated for amblyopia. And it can treat amblyopes of all age groups using dichoptic principles. And with dichoptic therapy, both eyes are presented simultaneously with images of different contrast, with the dominant eye receiving the image with a lower contrast. So in the brain, the two eyes are seeing the same now for the first time ever. It promotes the development of binocular vision by reducing inhibitory influence of the dominant eye within the ocular dominance column. And it offers this dichoptic amblyopia therapy in the form of games. So people play a game not even knowing they're busy doing therapy. And with progressive improvement in acuity, the games become more difficult with variation of the size, speed, and crowding of the stimuli. So the salient features are, it's cloud-based software, it's hardware agnostic. You do it on your own laptop, your own computer screen. It's a binocular approach, 30 sessions of 30 minutes. So most people do 5 days a week, weekends off for 6 weeks. It's clinical or home-based. We mostly use it home-based. It's effective as primary treatment of amblyopia. It's effective in adult amblyopia. It's effective in residual amblyopia, refractory amblyopia. Visual improvement is impressive, 4 lines typically in the amblyopic eye, and an improvement in stereopsis. The gains are permanent, and the company provides complete support. And patients will tell you it's simple and easy to use. There are a number of games. The results are fast. Within 6 weeks, you have the result. For children, you don't have the social embarrassment of patching. There's better judgment of depth and a high-quality 3D vision. And we've had 32 patients that we've had through Bynocs, and patients have this response. I cannot begin to explain how overjoyed I am that this therapy actually works. These are patients who've never had a solution. So the clinical results, this is from the initial Indian study. You can see different age groups, 4 to 8 on the left and 9 to 13, and you can see the significant improvement in binocular vision with therapy, including in the older group that typically we don't have treatment for. And you can also see in the two groups, on the left, aged 4 to 8, on the right, 9 to 13, how binocular vision improves, and 90% of patients develop or gain stereopsis. This is a case, a 23-year-old. You can see on the left eye, 624, amblyopic due to the anisometropia. The eye is suppressed for distance and near, and no stereopsis. And 6 weeks later, the eyes improved to 20/25, N6, there's fusion for distance and near, and you can see how stereopsis has improved. Another patient, 9 years old, amblyopic in both eyes, 612. The prism bar cover test, 30 diopters for near, 45 for distance, 120 seconds of arc for near, absent for distance, and following therapy, you can see the improvement. So the advantages of dichoptic management are very good compliance. You're playing a game. No one knows you even have amblyopia. There's a faster improvement in visual acuity, 3 to 6 lines in 6 weeks. Restoration of binocular vision. It's effective in the older age group. And there are no recurrences. From the regulatory side, it's FDA registered. There's global intellectual property secured. The CE approval process is in place. It's almost there. And it's also the same thing in Singapore and in India. Compared to other therapies on the market, there are quite a few in the space now, Bynocs is the only one that also addresses fusion and stereopsis and is hardware agnostic, so you can do it on your own hardware. You don't have to get any additional hardware. So thank you very much for your attention.
We have now 5 minutes for discussion, so Anyone on the panel who wants to ask a question to Arthur?
Can I ask a question?
Yeah.
Arthur, it was really interesting. Do you think it's possible to use these Bynocs in other directions when we do have problems with binocular visions? For example, our patients with multifocal IOLs, or probably to improve the neuroadaptation when we create an anisotropy.
That's a really good question. So I don't have personal experience, but I've spoken to the company a number of times about exactly that issue. And they've got a number of cases that have had success where the patient's about to be explanted from their trifocal because of dysphotopsia issues they couldn't deal with. And then they start Bynocs therapy and they keep the lens and love the lens. So it certainly helps neuroadaptation, no question. But I don't have personal experience.
Actually, I believe in this program because I use similar system. 12 years ago I started, and we have done few hundred cases, a system called Neurovision. It's for amblyopic. It was the startup started by Uri Polat in Israel. And actually, I'm still using this program. And the success rate, we have few 100 patients. It's improved 2 to 3 lines in amblyopic patients. We started from the age and above, not children, because children different type of...
We used that same program some years ago. I think they've rebranded to Revital Vision, I think they're called now. And we got the same as you, 2 or 3 lines. But yeah, we're consistently seeing 4 or 5 line improvement.
It's improving the
Yes.
visual acuity, the stereopsis from 300 seconds to 140. And we have follow-up of 2 years that after 2 years, even the stereopsis improving to 100. And we have done follow-up and the visual acuity remained after 2 hours. 2 years. We have to do some boost in few cases, but treatment, but it's good. I think this is a very good system. I think it should be.
Yeah, I've actually used Revital Vision in my clinic, and also I've started to use Bynocs, and I think I'm on the medical boards. I attended one meeting. My impression, Dr. Leminger, is that the Gabor patch-based system is very, very onerous on the patient. It really takes a huge effort for patients to sit in front of a screen looking at a patch that's switching around mindlessly,
30 minutes,
listening to
40
classical
times.
music or jazz or maybe some John Coltrane. You know, and the difference with this system is that I believe that the Revital Vision is working on the monocular cells, and it's trying to work at the lateral genetic body on trying to activate, you know, the system in that level, whereas Bynocs is working on the binocular cells. And the monocular cells tend to slow down in terms of their plasticity after the age of 7, as we were all taught in eye school. And, but somehow the binocular cells remain plastic forever. And this is what's, I mean, what for me was the big learning. I never, you know, it's nice to learn something new when you're older, that these cells do actually wake up. So our experience has been not as many as yours because we have fewer patients so far through the system. So we've had a mixed success, and I don't know whether that's related to the patients themselves. We've had one patient, for example, who was 20/30 in one eye, -6 or so, did smile, ended up on target, went for the program, and we detected that he had an increase in contrast sensitivity in his amblyopic eye, but we could not get the vision to be better. We communicated with the company about this, and the logic that perhaps the company's policy, which is that if you don't gain 2 lines, you get your money back, might have had something to do with the supratentorial enhancement that patient had, where the contrast improved, but the low-level contrast vision improved, but the 100% contrast didn't improve. So just to say that, you know, the company is doing this in a way which is almost like a no win, no lose, no fee thing. So if you don't get the effect, you know, take your money. You got to play a computer game for a while. But it is. I think it's one of the most interesting new things that has happened in the last year to us, anyway.
Yeah, exactly. All right. That's it. Thank you.